Hi friends, welcome to our channel. We are talking about diabetes, different types of diabetes, the ways of treatment, complications, how to attack them. We are talking about stem cell therapy and how to prevent it. The type 1 diabetes is now a group of diseases where the body cannot produce or use insulin. In type 2, it is more of insulin resistance and ineffective use of insulin. Sadly, there are no known cure yet for both conditions, and it is the seventh leading cause of death in most parts of the world, including India. According to American Diabetes Association, 23 million people in the US, maybe close to 30 now, but shockingly, least 1/4 of them are not aware of the condition they have. Now we have different types of diabetes, but most commonly known ones are type 1 or type 2, gestational, and some patients have type 1.5 or low non-stabilizing insulin levels, crucial for managing diabetes, right? If you're insulin resistant or insulin deficient, in both ways, the most common treatment involves, is to give injections, diabetic injections or pumps. Insulin pumps or frequently blood sugar levels, testing, continuous blood sugar monitoring. Researchers are exploring stem cell therapy as a potential solution. So if you don't have to worry about it anymore, and some of them have promising results, the researchers say, by recreating the Langerhans, islets of Langerhans in the pancreas. So type 1 diabetes, there has been cases where patients didn't need insulin injections for years. Now some clinical trials are even using cord blood cells or mesenchymal stem cells derived from other parts, especially for diabetic treatment. For example, in a study in 2017, researchers analyzed 13 studies from between 2006 to 2016 involving 342 patients who received stem cells similar to cord blood cells or mesenchymal stem cells, and another 111 who received stem cells similar to core tissue for diabetes treatment. They responded to treatment where some improved glucose levels and decreased insulin dependence for up to 4 years. However, there are still some unanswered questions about the ideal candidate, the administration method, the optimal dose, and the need for multiple transfusions. Now, there are some other things we going to talk today, not just stem cell, but promising studies that are going on. You need to watch out until the end. The Brazilian clinical trial with 21 adults with type 1 diabetes showed that a stem cell infusion could treat disease for several years. Now, most patients in this study were insulin free for 3, and a 2-year study with one patient didn't use insulin for 8 years. However, not all patients had the same positive results with stem cell transplant. Unfortunately, now researchers at the University of Florida, right here where their study is going on, have discovered expanded preserved cord blood cells that could serve a long-term treatment for type 1 diabetes. Now these cells, known as the regulatory T cells or Langerhans cells, we call them, type of white blood cells that prevent autoimmune responses. Remember, they the type 1 disease and type 1 diabetes is a result of autoimmune attack to your pancreas. But by using these cells, it can stimulate and activate the regeneration of cells and decreasing the inflammation. So these cells are a huge breakthrough and could lead to replenishing these low T cells in certain people, replacing the ineffective T cells with the new ones to prevent autoimmune attack. And additionally, this study brings us closer to utilizing the cryopreserved cord blood cells for various therapeutic uses. And this one being very important, type 1 diabetes is having tremendous role, and the stem cells are really something to look out for the future and being used in certain conditions like diabetes as well. These stem cell with a particular device can be separated and cultured in the lab, multiplied, and these mononuclear cells with one nucleus with the cord blood cells, before returning the cells, they are given to the patients. And so unlike stem cell therapies, the stem cell educator does not introduce new stem cells into the patients. Instead, it eliminates the need for matching and rejection rates, because it's from the own patient, and it eliminates the need for, again I told you, any kind of matching, and the treatment is for about 8 to 10 hours, so that several ongoing trials are worth noting. For example, an Australian study is investigating whether reinfusing child's own cord blood can prevent type 1 diabetes in those at high risk, while the Institute of Metabolism of Endocrinology in China, they have been doing a study on T cells from the cord blood for diabetes. In China, they're also facing a huge problem, and this trial as a stem cell educator for both. And in the US, there is a new study that has come up, Verapril, which is a generic medication for blood pressure, interestingly given once daily, within 30 days after diagnosing type 1 diabetes, slowed the beta cell decline over 52 weeks in children and adolescents. 7 to 17 type 1 diabetes usually see a small improvement in the C-peptide levels after diagnosis and insulin treatment, but typically declines later due to autoimmune beta cell destruction. So these kind of people can be given enhanced stem cells, and the improvement of C-peptide are being seen in random group and has a longer period of stability before it started declining again. Now, given this favorable safety profile, oral administration, and low cost compared to those fancy immunosuppressive agents or stem cell therapies, and it should be considered for newly diagnosed type 1 diabetes patients if clinically they are okay. And the FDA also has just approved a medication called Tezal. It's pretty cool injection. It's not cheap, but can also delay the onset of stage 3 type 1 diabetes, and in adults, kids, and who are already in stage 2 diabetes. So This means that type 1 diabetes, if you're type 1 diabetic, you're already taking insulin. So these newer therapies could help you to prevent risks and can actually help those patients who have some extra time without having to deal with type 1 at an early age. Now, type 1 diabetes, as you know, is an autoimmune self-destruction. Being a little too aggressive, it can attack the beta cells of the islets of Langerhans. They need regular shots of insulin, especially younger age. Sticking a needle in their tummy or in this thing is really heartbreaking, and this types of newer modalities can help them. And people at the age of 80, usually affected kids with type 1 diabetes, can put you at a risk, as well as not everyone with type 1 diabetes has got a family history. But if you are one with a family history and slightly increased risk, now this is T cell medication is a real genius, because it stops the immune cells from progressing, and thereby we can reduce the type 1 diabetes, calm it down and reduce the attack, and improving the insulin production and beta cells, and increase the good guys that keep things in check. Now, the downside is, by giving IV infusion once a day for 14 days straight, it's kind of a bumper. At the same time, after all the leaps and bounds and medical science, all the heroic adventures into the microscopic universe of cells and all these laboratories across the globe, guess what? We still don't have a definitive cure for diabetes, especially the type 1. Definitely not for type 2. It's like that super stop bond brain on your favorite shirt, just one budge, and it is very difficult to take it off. Thank you, dear friends. Take care. So, stem cell therapy and other newer modalities of treatment are there to look out for. Keep watching this channel if you have liked it, and subscribe, share it with your friends. Thank you.